good afternoon, good morning, good evening, depending on where you are. I know we are all scattered across the globe, and I'm so excited to be here. My name is Dr. Faith Mwangi Powell. I'm the CEO for Girls Not Brides. And this meeting is a collaboration between Girls Not Brides, who is a global partnership to end child marriage in collaboration with the Women's Refugee Commission, the Johns Hopkins University, UNFPA-UNICEF Global Programme to end child marriage. So I'm really, really excited to welcome you here today. And the purpose today is to really learn and hear how to conduct ethical research on child marriage in humanitarian settings. And I'm excited that there are so many of us joining, including Ferdinand from Uganda, who is sitting in his car. So welcome again, Ferdinand, and everybody else sitting in your sitting rooms, in your bedrooms, wherever you are sitting. I'm so excited that we are here because this is an opportunity to bring together our efforts and to further strengthen our research agenda on addressing child marriage in humanitarian settings. As you all know, there is predicted that we are going to see maybe over 13 million new child marriages across the globe. And we know that 10 countries with the highest child marriage prevalence rates are either in fragile or extremely fragile states. And if we are going to deliver the promise of the Sustainable Development Goals in 9 years, it's a very short time. If we are going to deliver that promise of zero child marriages, then we really need to accelerate our efforts. We can only accelerate our efforts if we know what to do. If we learn and understand what are some of the ways we can end child marriage. Situations of humanitarian settings have seen accelerated levels of child marriage, and the COVID pandemic has not helped us. If anything, it's undoing some of the successes we have seen over the years. So today, we are looking at how can we share this platform with our practitioners and across the regions so that we start unpacking some of the challenges we face as we conduct research in humanitarian settings. We are going to work through those and look at how we can really deliver ethical research, because that's one of the challenges we have. As I said, this is a collaboration between the UN Joint Program, Johns Hopkins University, Women Refugee Commission, and you're going to hear some of those lessons and learning from those people. And I want to acknowledge our friends Shadia and Idrani from the Joint Program. Programs such as the Global Programme to End Child Marriage and initiatives such as the Child Marriage Research Action Network, which we call CRANK, which is a collaboration between Girls Not Brides and the Global Programme, are needed because they bring that much needed learning to the opportunity we have right now so that we can accelerate our efforts to end child marriage. We need to double, triple what we are doing right now if we are going to undo the damage of what COVID has done or is likely to do, because the COVID situation is still unfolding in many countries. And we need to know what we don't know, and we need to know what works. So today, as we look at how to do ethical research, it's our opportunity to really unfold that platform and make sure that we use what we learned today to bring the much needed lessons so that we can start working within the situations we have. I will not take any much longer because you have a packed agenda this afternoon. So I will invite my colleague, Jean, to just provide us more details on today's program and what we can expect to hear this afternoon. I want to wish you a good webinar. It should have been better if we had met face to face, but this is the world we are in, and we appreciate for being able to connect with you even through the Zoom platform. Thank you. Over to you, Jean.
Thank you so much, Faith. Thank you for that lovely welcome. I won't take long, just to briefly run through the agenda for today. So we'll start off, Janna will provide us with an overview of the Child Marriage Research Study Series. Then we'll move into an introduction to the Practitioner's Guide, and this will be led by Court. After this, we'll split into breakout sessions, and we'll focus on 2 case study examples. We'll take about 25 minutes for this part of the series. In breakout room 1, we'll explore a case study on consenting emancipated minors in Yemen. This session will be in English and Arabic, and Court will facilitate the session. And in Breakout Room 2, a case study on identifying issues in public accountability. That's a case study example from Cox's Bazar in Bangladesh. This will be in English and French, and Janna will facilitate this session. When we come to the breakout sessions, we'll explain how this works when we arrive at that point. Then we'll come back into our discussion groups and we'll run through the key takeaways of each of the case studies and have some time to address further questions. And finally, a short wrap up and close of the session. So this will probably take us, all in all, I would say, up to an hour and 20 minutes. As we go along, you can post any questions or comments you have in the chat. Please do that, and we'll do our best to address these as we go along. Just a reminder to everyone today, we have some excellent translators working with us on the session today, so please do try and speak slowly and clearly just to give them the support they need. And finally, just to reiterate how excited we are at Girls Not Brides to collaborate with our colleagues and importantly to create a space to promote shared learning on this vital and complex topic of child marriage and research ethics in the humanitarian settings. And with that, I'll hand over to Janna to lead us through the overview.
Okay, thank you very much. Is my sound okay? Hear me okay?
Yes.
Great. So thank you, Jean, and thank you, Faith, for those wonderful, kind welcome. Before I get started, I wanted to take a moment to introduce two colleagues. I am so delighted that they're able to join us today from the Johns Hopkins University Bloomberg School of Public Health. They were both instrumental in the implementation of several of the studies that we're going to talk about today, several of the studies that are featured in the guide and actually the creation of the guide itself. So I'm so delighted to have Shatha El-Nakib with us. She's a doctoral candidate where she is conducting her dissertation research on child marriage in humanitarian settings. Over the past 2 years, she's been working as a consultant for UNICEF and WHO, carrying out research on adolescent sexual and reproductive health and child marriage. We're also very lucky to have Kara Hunterson with us today. She's the Assistant Study Director for the Global Early Adolescent Study, which assesses how gender impacts the health and well-being of adolescents aged 10 to 14, living in urban, poor settings around the world. So I want to just give a pause right now and see if Shatha and then Kara would like to say hello to you all, and then I'll come back and talk about the studies as a whole. So Shatha, over to you.
Thanks, Janna. Hi, everyone. Like Janna said, I'm a doctoral candidate at the Johns Hopkins School of Public Health, and I've been engaged in several of the child marriage studies, and specifically the ones carried out in Lebanon, Ethiopia, and Egypt. And the Egypt study was part of the latest series of studies that were implemented in the Arab region, and it was actually conducted among Syrian refugees and Egyptian host communities in Greater Cairo and Damietta. I'm very pleased to be here to share the findings of our work, and I urge you to read our papers. Two of our papers have just been published in BMC Public Health, one about Ethiopia and one about Egypt. So if you're interested to read more, please review these papers. And I'm looking forward to today's discussion. Thanks, Janna.
Thanks, Shatha. Over to you, Kara.
Hi, everyone. So nice to be with you today. Like Janna mentioned, I worked on this study. I was the lead research coordinator for this work, mainly in Ethiopia, Yemen, Kurdistan region of Iraq, and Djibouti, and was mainly part of implementing the fieldwork and have also been able to follow up with data analysis in a number of the sites as well, especially in the Kurdistan region of Iraq and in Yemen. I'm really excited about launching this guide. I think it's such an important topic. We faced a number of ethical challenges in each of our studies, and in humanitarian settings, it requires such a unique perspective on the ethics of research with young girls. So excited for this talk today and looking forward to speaking with you all.
Well, I'm so excited that you all are joining today. So let's talk a little bit about how the guide came to be, and then I'll turn it over to Court to really dive deep into it. So over the past decade, WRC and which is the Women's Refugee Commission, has collaborated with Johns Hopkins University and a broad consortium of local actors to examine both the prevalence and the drivers of child marriage in humanitarian contexts. We also work to identify good practice in prevention and risk mitigation programming over this time. To give an example, we collaborated with IMC, Ethiopia, Save the Children in Lebanon, the American University of Beirut, the Adolescent Reproductive Health Network in Myanmar. And this was early on to examine the needs and risks of very young adolescents in refugee contexts, and also the impact of conflict and displacement on marriage practices. In that body of work, we discovered and had very young adolescents identify that child marriage was the primary cause of school dropout in that work. So as a result of that, we developed several different pilot programs in 3 different settings in Ethiopia, Myanmar, and Lebanon, and later evaluated to examine the impacts of that programming. So as our work together evolved in 2016, we began a series of prevalence studies in humanitarian contexts to gauge the magnitude of the problem amongst different populations, and also examine the key drivers of the practice to help inform prevention and risk mitigation programming. Since its start, as you can see from this beautiful map here, we've conducted 9 different studies. You can also read through, we have summary reports for different regional studies, and then we also have other materials that are accessible. On the next slide, one thing that became very clear in our work together was the need for guidance around ethics, having worked with multiple field teams on a very challenging topic, needing guidance around ethics as it relates to humanitarian settings, working with children, and then specific to child marriage research. So this guide is a product of that. It has documented the learning of our work with field teams over the past few years, actually over the past probably decade, as we were confronted with different situations during the conduct of research. It's really meant to be a guide for practitioners and one that hopefully will evolve over time as we learn more and work more with practitioners. It's a guide as you work to navigate challenges around, let's say with the IRB, or issues of confidentiality and privacy, how to interview children and emancipated minors, which comes up, and how to reflect on community engagement and public accountability. So I'm delighted to have the opportunity to share that with you today. And I'm going to turn it over to Court for an introduction to the guide and a deep dive, hopefully, into it. Over to you.
Thank you, Janna, and thank you to Girls Not Brides for organizing this webinar, and welcome to everyone. And as Jen explained, this is a practitioner's guide for the ethical conduct of research. And I want to start with just a few key principles. The idea here being that ethical conduct is not simply a matter of how do you get an institutional review board to approve your study and then handle some paperwork along the way. It really goes to the very core of how do you relate to vulnerable populations, whether as individuals or as communities or both. And we're guided in this work by a number of key principles that are in the Belmont report, WHO guidelines, a whole variety of systems and networks that have endorsed these approaches. The first one being simply do no harm. That's a program commitment as well as a research commitment. But in the context of research, it's about protection of privacy during an interview, of confidentiality of data, assessing sensitivity of topics and questions, particularly around child marriage, and then consulting local stakeholders on laws, values, norms, and identifying referral services in the event that someone demonstrates upset or there's some kind of adverse event that occurs and you need some assistance in dealing with that. The second principle is balancing risks and benefits. How do you make sure that risks are minimized and benefits are maximized, whether those are at the individual level or societal level? But whether risks are higher or lower, relatively speaking, they should always be outweighed by the benefits. You must show some kind of even societal benefit that outweighs whatever the risks might be involved or participating in the study. And last but not least, respect for persons. which in the context of research simply means that people should have the opportunity to choose what should or should not happen to them. And the informed consent process, if done properly, provides adequate standards for respecting persons, whether children or adults. But as we'll see in the next slide, please, there are certain issues that relate to, sorry, back one, thank you, that relate to vulnerability of all populations, or certainly many, in humanitarian settings, and specifically children. But before we get to that slide, some key issues in the humanitarian context really have to do with needing evidence to inform policies and practices, whether that's in health or social services, or programming of many different kinds. And as we know the need for evidence, we also know the need for proper research. And we look to some kind of guidance about how to do that. There's peer-reviewed journal articles, there's a variety of other documents out there, and we hope this guide will take its place among a lot of other resources to help lay out what some of the challenges are in humanitarian contexts, what has been done in the past, what might be tools and tips and tricks, if you will, to help guide practitioners, but also to just unpack some of the particular ethical issues that we encountered that you might in your research, and also may help identify others that we can all learn from as we go forward. Next slide, please. And last, we come to children. So it's very clear in the biomedical literature and ethical literature in general about human subject research that children are vulnerable in two ways. One, they may lack full developed cognitive capacities to be able to give consent on their own. And they may be subject to legal and social expectations of deference. It's an interesting phrase. The idea that they may not express an opinion out of fear that an adult authority of some kind, be it a researcher or a parent or guardian or somebody else, or a member of the community, may not have their best interests in mind. And so we want to keep foremost in our mind the idea that children and their best interests must be served, as well as all of the other hoped for benefits of research to inform policy and practice. And because of this limited capacity that children may have cognitively, and because of this deference to adult authority, we want to make sure that they are particularly well protected, and add in the vulnerability of humanitarian crisis, displacement, poverty, disadvantage, all of the other ongoing and continuing social and gender norms that may constrain the ability of a girl to act on her own behalf within a family or outside. We have a number of issues that are quite complex and of course quite salient to research on child marriage in emergencies. Next slide, please. So these are the studies, and Janna has gone through those already, so I won't belabor them, but if you look on the left-hand side, you'll see a whole array of people, organizations and individuals who participated with us as study partners, as sponsors, as IRBs, institutional review boards. I won't mention them, they may come up in the case examples. And then on the right, simply showing of the studies that we conducted, how many were both qualitative and quantitative, or as we would call them, mixed methods, and how many, for various reasons, budget, logistics, security, were only qualitative or only quantitative. But this gives you, I think, I hope, a breakdown of where we did the research and how that work has informed our development of the guide. Next slide, please. This guide is 10 chapters long, and includes an introduction. And then, as you'll see on the left-hand side, some discussion of research in humanitarian settings, vulnerability and vulnerable populations, privacy, confidentiality, informed consent, IRBs, some issues of study design and methodology as they relate to ethics, implementation, community engagement and capacity building, and certainly not to be ignored or omitted, public accountability. How do we make sure that people learn about our work, share our work, and that we are accountable to the public, and the public has access to our findings. Each chapter lays out the topics and then also includes a checklist. So it's meant to be kind of hands-on, interactive, with some annexes at the back for references for reading, as well as resources for further guidance on ethical conduct of research and research methodologies themselves. And then finally, a section probably dated already on research ethics and safety during COVID-19. Next slide, please. We introduced in the guide, I think 16 in all, case examples, and we're going to give you 2 examples in the breakout sessions that are about to start shortly. And you don't need to read all of this. You'll have a chance to go through this in the session that focuses on Yemen. But one example that came up was emancipated minors. This is a term given to children who are underage, but maybe acting as a parent by being married, or an adult, I should say, by being married or having children, or in some other cases, heading a household where they are themselves the main breadwinner and are responsible as adults for their own livelihood and best interest. They may simply be separated from their families, and you can't find a parent or a guardian for consent. And so they're consented as adults by virtue of being emancipated. But laws and norms and customs are complicated. And we had some issues that we dealt with not only in Yemen, but elsewhere. And we'll look at that example as one of the 2 in our breakout sessions today, but we have 16 in the guide themselves. Next slide, please. And the other is an example, this one actually in Bangladesh, where we knew going in that the Rohingya language had no written form, and therefore was necessary to find people who were interviewers who spoke Rohingya fluently and could read from the script and translate verbally. But this raises questions then also about how does one share findings back to a community where there may be no written language? Or if it is a written language that exists, it's not generally known to all of the community, but only maybe to higher educated, more of the elite. So questions arise about how does one deal with illiterate populations, both in terms of obtaining consent, making sure they're aware of what they're getting into in the study, but also sharing the findings. And this comes back into the issue of public accountability. Next slide, please. And then we have some questions, as I said, at the end of each chapter about how to kind of unpack an issue from the practitioner standpoint. So for example, here, determining vulnerability, who are you interested in studying? If children included, what kinds of children? Are there unaccompanied separated children? Are there ethnic, religious minorities that we have to be particularly attentive to? How does vulnerability show up from a research standpoint, as well as a programmatic standpoint? And how do we build in safeguards into our study so that those vulnerabilities are protected and do not end up in the context of the study causing harm? Next slide, please. And I think this is the last before we get into breakout sessions, but as I said, we also included some discussion of COVID, how COVID has been impacting children. And I think Faith mentioned some of those issues at the very outset about possible rise in child marriage as a result of COVID, people being locked down, people facing greater levels of poverty, loss of livelihood, and that can be a driver, as we know, in emergency settings and non-emergency settings for child marriage. And we also introduced some other materials about how to work with children in the context of COVID, so that we make sure we're not, again, causing harm by introducing interviewers into an area who may also be perhaps introducing COVID spread. So we want to be very thoughtful about those elements, in particular in the context of COVID. Next slide, please. So now we're ready to break out into sessions, and from here, I will look to our organizers to guide me if I make any misstatement here, but I think you will self-select for one of the breakout sessions. They will be conducted in group 1 in English and Arabic, and I'll be joined by my colleague Shada El Nakib, also an Arabic speaker. I am not, but she is, to have that. We will not have simultaneous translation in the breakout sessions. These will be consecutive. And then breakout 2, looking at public accountability, using the example of Cox's Bazar in Bangladesh, will be in English and French. And Janna will facilitate that, working with Kara Hunterson as a resource person. So I think without further ado, we will break into those groups, and we'll spend about 25 minutes. And then we'll come back and discuss. And I'm going to ask at least one person to be a sort of rapporteur for each of the 2 sessions. We'll discuss, and then we'll wrap up. Okay. Hopefully that's all clear, and we'll see you on the other side in the breakout rooms. See you soon.
I think we're all here now, Court, if you want to take it again. Thanks so much.
Okay, thank you. So Janna and I hadn't worked out exactly in detail how we process this, so I'll just simply say, first of all, we're looking for a volunteer from each group. And we can start with group 1 or group 2. If it's group 1, then maybe also to facilitate, and group 2, maybe Janna could do the same. And Shada and Kara, feel free to jump in as well if you have thoughts. So we have about, was it 15 minutes on this? Ish?
Yep, that's it.
Okay, good. So do we have volunteers, first of all? And then what we asked you to think about is what sort of issues came up in terms of best interests of the children, local laws and norms, public dissemination, what might be implications or applications for your work. And maybe this is for discussion in the full group, how might the guide and other resources promote ethical research in child marriage in your settings, and what next steps might you be anticipating? But that's a lot of different questions. Maybe we'll pause for translation. Do we need French and English? No, this is now back to simultaneous, excuse me. So Janna, do you want to jump in with any thoughts or comments?
From our group or from your group?
Well, or just any comments to set up the discussion.
No, I think you set it up very nicely.
Okay, so any willing volunteers? One from each group? Don't be shy. No? Would it be fair, Shada, to ask you to offer a few thoughts on sort of what was discussed? I don't want to put you on the spot having just done that, so feel free to decline.
No, sure, I can. I thought it was very interesting how we talked about which laws and norms we should follow in these settings, where sometimes you have, for example, in Yemen, bifurcated government. So you have two sets of governments. Which laws on ethical conduct would you have to follow in a setting like Egypt, where you have Syrian refugees, for example? Should you follow the laws of the country of origin, in this case Syria? Or should you follow the laws and norms of a country like Egypt, which is the host population, which is the host country? So some of these issues were very interesting. And also Kristen had some very interesting thoughts. So maybe Kristen can also share some of her contributions to the discussion.
Thank you. That's very kind to invite me to the floor. So thank you. I'm Kristen from Taldism. I actually know Janna. It's lovely to re-see you. We saw each other 2019 in London, I think, at the British Academy. But anyway, my thoughts were around the question of jurisdiction and essentially how often in many contexts family law is governed by religious courts. And so you also have contexts in which it's not just the secular sort of civil law of a state, but also you can have, family law, which is governed by different family courts, depending on which is the official recognized religion in the country, or if there's, in context of, religious pluralism, if there's multiple different jurisdictions, and essentially you're left to navigate across, different, legal provisions, but also with very different actors and and alongside the context of a state, and which is even complicated if there is conflict in that state as well. So so multiple layers and multiple interlocuteurs.
Thank you for that, Kristen. Maybe could we hear from group 2? Any willing volunteers, or if not, we could call out Kara or somebody to try to summarize, but I'm going to leave that for others to decide. Group 2?
I can start with the summary if that's helpful, and then others can certainly jump in. So we were discussing basically sharing results back with the community, and especially in the context of Cox's Bazar, where the language of the study population is not a written language, and how it's important to communicate those results in a way that is accessible to that community, and doing so through audio messages. But we also talked about what the messages you are communicating are, especially some results that might be considered controversial or contrary to a kind of logical belief, especially findings about, certain authorities not enforcing child marriage laws, or findings around how, in this setting specifically, how the humanitarian response actually potentially facilitated child marriage, or was a contributing factor to child marriage. And some of the interesting points were around how to communicate those messages, especially the challenging ones, and leveraging community leaders and people who are well respected, who can take some of these difficult results and share them in a way that the population will accept and actually respond to. So that was an interesting point. And then the other one about the challenges with putting the population at risk by disseminating certain findings, and making sure that if it's a finding that could potentially cause harm to the local humanitarian response, that there needs to be some kind of risk mitigation strategy associated with disseminating. It's not just something you can go out and announce. It's something that really needs to have some thought put into how that message is being communicated, so that the population itself is not being put at risk.
Thank you. So others from either group, thoughts on what you discussed, any thoughts on how we kind of take those kinds of issues forward, whether you have concrete examples of what you all have done, or whether some of this discussion has been sort of bringing up some thoughts and ideas about possible implications or applications for your work.
Court, this is Ali from Iraq.
Yes, go ahead.
Yeah, the main part for me that's like important ones to me, again, repeating the point of the legal gap. And, we work together on this part, and we see that's really an issue because, as I said, one of the colleagues even mentioned to control the religion leaders or sheikhs, mullahs, to not marry such kind of, according to my understanding, I understood in this way, to stop to marry underage. But again, if the legal revise it and let's say provided in better way to have very how can I say hard restrictions for the underage adolescent girls, even boys, by the way, it's not only girls. So that's really an important one. That's again what we reached in KRI and Iraq as well. That's discussed the point, and the other point mentioned in the group one, that traditional part, which is really affecting. That's right. Sometimes even parents doesn't like to marry boys and girls underage, but traditional wise, they're facing like pushes by the leaders and so that's still a pending issue. And another issue is actually because of the economic crisis regarding of the displacement people, and now became again the second displacement because Iraqi government are closing the camps and sorry if I'm saying by force, and pushing them to go back to the place of origin. Some of them couldn't able to go back to the place of origin. They go back to other place because of the safety and other things to be safe and feeling safe. Maybe if, especially female-headed households, if they go back to the place of origin, that may face other issues. So in this regard, they want to marry daughters, and they feel to make them with a husband to be maybe more safer, something like that. So that's pending issues still in Iraq. We have it, and I think awareness raising mentioned again for both for adolescents and parents. That's really important, and in particular about and laws and rights and so. Thank you.
Thank you, Ali. I'm noticing we have a chat from, is it Rafiki in French, en français. Could somebody verbally translate that for, I know there's a simultaneous of what's being spoken, but since this is written, could we get a translation, a rough, not rough, but just basic translation of the comment, and maybe Rafiki, if you would like to verbalize that in whatever language you wish.
Court, you're asking me to translate, or?
No. Our French translator.
Okay. Sorry.
Sorry, Ali. Yeah. The comment from Rafiki in the chat. I'm just noticing we have some comments in French now and one in Arabic as well, just to make sure that those are translated for people, or if somebody wants to just unmute and verbalize those, and then we can translate simultaneously.
So from my limited French, I think they're just Rafik is just asking for interpretation from English into French.
Okay.
Because he's in DRC, I think, right? And
yeah. Okay. We do have a question or comment from Ferdi, and you can unmute and verbalize this, but saying, I'd like to know if there's any means of handling issues that come up with cultural norms in trying to end child marriage, which differ from local laws. So I think that relates to some of the conversation we've been having about how do you promote change, and if your findings do promote certain awareness of drivers or groups in the population that may be either pushing for change or resisting change, how do you deal with sharing those findings in a way that may come up against local laws or norms, and in the act of promoting change, possibly also promote tension? One hopes not conflict, but certainly there may be disagreements about not necessarily what the study found, but what to do about it.
So Court, we had an interesting discussion just on that point about the case study in Bangladesh, about how we learned that some of the Rohingya families, many of them were arranging marriages prior to returning back to Myanmar, where it was more strictly regulated as a practice. And it was the lack of enforcement of the governing child marriage law within the camps that created this enabling environment for adolescent girls to be married. Well, boys too, but mostly girls. And so we talked a little bit about that and the risks of disseminating that information over the benefits of disseminating that information, and some of the likely consequences of that, in that, you know, if you have more adolescent girls who are being married, you have more child-headed households as a result of the food aid distribution and the policies around that. And some of the risks and the offshoots of sharing that information could be cutting off food rations to child-headed households, right? And so how do you navigate that space that's created by this enabling legal environment within the camp?
Thank you, Janna. That was very helpful. Any other comments? And I would emphasize that the guide is not to try to answer any of these questions, certainly not in your context. Every context is different, but rather to provide a framework for processing the kinds of questions, starting with the questions themselves you want to answer. Why do you need to do research on a particular topic relating to child marriage? How do you do that? How do you implement? How do you monitor, make sure that nobody is being caused harm? And then how do you share results in a way that promote and maximize benefits and minimize risk? So again, we're not trying to say we have all the answers. What we hope we are providing is a kind of a guide for processing the questions and dealing with issues like privacy, confidentiality, IRBs, and the like. Any other thoughts or comments? We have one comment from, I hope I'm not mispronouncing your name. In many countries, if poverty and gender discrimination are overcome, I believe child marriage definitely disappears. The question then is, how do you alleviate poverty and gender discrimination, not just relating to child marriage, but in general? But yes, we certainly found even in humanitarian crises, these sort of drivers that operate in non-crisis settings also operate in humanitarian settings. They're often amplified or modified in certain ways, but they're often many of the same drivers. Do you want to unmute and comment further on that? Or you're muted.
Yes, I think you summarized very well, but underlying causes, I think we should do research on underlying causes and use this research results to convince the policymakers. They are supposed to change the law and implement the legislation, so on. So underlying the major causes of this child marriages is hard issue, but definitely necessary. But thank you. Very stimulating session we had. We think about, we couldn't say what we wanted to say. Sometimes the language problem, barrier.
Well, feel free to speak other languages if you wish, if you feel.
Turkish,
Turkish, do we have any, well, I'm not sure we have.
No.
Maybe we do.
Thank you.
Thank you very much. Anyone else? I know we're coming toward the end to get into wrap up, but just a few minutes left. Any additional thoughts, people we haven't heard from yet, or folks we have, we just want to add another comment? Kristen, did you have your hand up?
Yeah, thank you for opening the floor. Just very quickly, I think that there's a great question in the guide, in the section about data sharing and results, which is about also, you know, who needs to be at the table and involved in discussions about planning for data sharing and what competing interests should be addressed. And I think that's so important because I think that it touches on a question that was raised in our breakout group, which was around basically who owns research, or why do we research, or for what end, and then, you know, how do we expect that research can be used to influence processes of change, and what sort of and who owns that change, who takes that change forward. You know, obviously change it's a long-term process. It requires broad coalitions, and there's different individuals and organizations have different levels of risk or protection or privilege. And so I think that it's really important to think, making sure that there's all of those different people can be at the table when discussing and deciding about how dissemination can take place, and even co-creating, you know, specific deliverables of research. For example, right now we're in the process with Adolescent about co-creating research, the child-friendly findings of research that we've conducted with Syrian refugee communities in Lebanon and Jordan. We're creating them with children, so that we're trying to go through that process with children from those communities to create the sorts of outputs that are most relevant for them. And I think that, you know, it's difficult and it's challenging, but I do think more participatory approaches are going to have more traction in the long run. Thank you.
Thank you for that. I think, Janna, this is very much your wheelhouse. Do you want to comment further on sort of data sharing, not just the what, but the how, and to whom?
Maybe.
No, I don't mean to put people on the spot, but
no, I think Kristen said it very, very eloquently. It's having that conversation in advance of who is at the table, and then also what is the ultimate purpose and how you develop different knowledge products for different populations should be central to when you're actually designing the research, right? So kind of the beginning stages of this work with engaging communities has to involve these discussions. And yes, so I don't know if I would add anything to Kristen's comment. I think it was very nicely put. I think also the guide does talk about a little bit about guidance around data sharing agreements and things like that that could be put in place to help us think through in advance, right? Because oftentimes I think it's an ad hoc add-on at the end of the project, which is not as mindful as we'd like to keep it in the framing of the project. And that these are issues that will come up. We know they will come up. Let's think through them, and let's think through them with communities. That's all I'll say.
Thank you. Any other final thoughts? I know we're moving toward wrap up. Jean, any comments and how to sort of shift from discussion to wrap up, or where are we in terms of time?
That's fine. I can take that under my wing if you would like, Court.
As you wish.
Okay.
Please.
Yeah, I think it's been a really great discussion, and it's really been great to thread so many of those points together around the need for better data collection, to generate evidence that's grounded in ethical and robust research processes, and also to think about that piece around who's at the table, the co-creation, participative methods, and then just how that links in as well as one of our participants was saying about really using the evidence to underpin our program and advocacy efforts to address child marriage in humanitarian settings. And I think today's learning session has gone some ways to addressing these issues by providing us with a really valuable space to share our practical examples and learn from each other, and collectively reflect on ways around the challenges that we commonly face when attempting to uphold our commitments to carrying out ethical research on child marriage. And I think what the practitioner guide does so fantastically is it unpacks the many complexities, and chapter by chapter it really lays it out in an accessible style and presents considerations and case studies for practitioners as they explore some of the more practical questions around research on child marriage in humanitarian settings. And as Court was just saying, you know, the guide isn't saying that it has all the answers. And I think that framing is very important as well. And it really kind of sets out from the beginning that it's a framework for practitioners to take informed and ethical decisions about the research process within specific contexts. And beyond coming together for today's session and the valuable insights that we gained, I really do hope that we can collectively strengthen our work in this area and support each other to do so, and continue the conversations and dialogue as we go. With this in mind, I also just wanted to come back to the Child Marriage Research to Action Network, or the CRANC, which Faith mentioned earlier in the introduction. And just to flag, this is also a really useful platform for coordinated global research agenda on child marriage, and brings together child marriage researchers, practitioners, and policymakers every 3 months to share and discuss the latest evidence on priority learning topics. And we had our first global meeting in March, and that was we were sharing evidence on gender transformative approaches to ending child marriage. And we're currently preparing for a second session in June. And I think Matilda is going to post a link in the chat for people, so you can sign up. It's open to everybody, and we please welcome you to join the network so that we can work more on that coordinated level. And finally, I would like to thank Janna, John, Kara, Shatha, Indrani, and Shadia for coming together to deliver this really impressive collective peer-to-peer learning session. And also thanks to all of you for turning up and getting stuck in. We hope to have other opportunities to continue these important discussions in other forums and through other channels this year and beyond. And just to say, we will follow up with the recording, and we will have some keynotes as well. And if anyone has any feedback or would like to follow up with me or any of the team on any of the issues that we discussed today, please do let me know. And I think that's it from me. Court, I'll hand over to you and Janna just to sign off if you would like.
Okay, maybe a few minutes, and then a few seconds actually, and then to Janna for the last word. I just want to say thank you for the valuable insights and comments and the interaction. My greatest hope is that you use the guide for whatever purposes you find it useful for, and give us feedback, things that might have helped, things that might need clarification, and areas that perhaps we didn't cover that you'd like to explore further. So it's an organic, iterative process, as a lot of research is, and we really hope to continue to work with you, collaborate with you, and learn from you. So I'll hand it off to Janna for the final pearls of wisdom. Go ahead.
Thanks, Court. I would echo your sentiments as well, that it's a work in progress, and we value your thoughts and feedback. And thank you for joining us. And if anybody is interested in maybe even piloting this guide as a resource in your research, please do reach out to Court or myself, because we'd love to learn more about how this is useful. So thank you. And thank you to Girls Not Brides for letting us join you for this hour and a half. And over to you, Jean, for the close.
Great. Oh, Ferdy, I think you have your hand up. Would you like to say something? Oh, it might be an old hand. We're just about at time now. So just to say again, thank you so much to everybody, and particularly to all the participants who turned up. We really value your time. And also, I just want to say a thank you to Laia. And
thank you so much.
Who has been doing a fantastic job in bringing this Zoom to your bedrooms, your offices, or your cars, wherever you are. And thank you so much. And we hope to be in touch again and to continue this discussion.